My name is Peter Walker. I'm the voluntary sector rep on the Health and Wellbeing Board for Bristol City Council. The board is now for the first time at its meeting on the 4th of July. It's now constituted as a subcommittee of the council. So that means that all those taking part have to abide by the rules of the council. And one of the tasks we've all been given is to basically, first of all, declare any interest we may have, but also agree to abide by the process that all councillors have to abide by, which is basically not to go in to any meeting with any fixed views or prejudices around particular topics that are going to be discussed, but to be open to hear all the sides of the various arguments about a particular issue. So that's all good stuff. So that's now in place, and the meeting, a number of things occurred in the meeting in terms of the issues relating to membership. Of particular interest is around Health Watch and interest of the voluntary sector and users of health and social care services. Health Watch will in future have the brief to represent the equalities issue, which has been raised on a number of occasions with the Health and Wellbeing Board, the fact that it needs to have some specific representation around that. So that's going to be contained in the brief for one of the Health Watch representatives. There's going to be two altogether, and currently the voluntary sector, apart from myself, has the Care Forum and the Carers Forum attending the meeting. Anyway, the Health Watch will take over that particular the particular interest around carers and the Care Forum in that respect, people using services. The big item that's been around for some time has been the Health and Wellbeing Strategy, which will form the basis of the work programme, effectively, of the Health and Wellbeing Board over the coming years, and will obviously give the strategic thrust to health and social care initiatives in the city overall. And the strategy hasn't yet been, it's almost there. Obviously there's been a huge amount of input and feedback as part of the consultation exercise, and the sticking point was at the meeting was trying to clarify the priorities, not necessarily in terms of what the priorities are, but how they sit against each other, if you like, and whether they make a lot of sense when someone reads them. So some of the issues are obviously around alcohol, about domestic violence, around mental health. It's trying to turn those issues, which are clearly priorities for a lot of people, into something specific where the Health and Wellbeing Board can add value, and that's the key. It's not just saying the Health and Wellbeing Board choosing priorities, which you know, like motherhood and apple pie sort of thing, everybody would agree to it. It's trying to identify those things where it can actually make a difference by being involved and taking up those particular issues. So there's a bit more work to be done on that. I'm involved in a little subgroup which is trying to refine some of those things, and the aim is to get that signed off ASAP in order for the strategy to be put out into the public domain as a final strategic document. So that's quite a big issue. I say a lot of discussion around those priorities, but I say not a lot of dispute about what the priorities are. It's just how they come across and what they actually mean, are going to mean in practice. Discussion about the work programme, following on from that, really for the Health and Wellbeing Board. And as it's a new body, it's really finding its place in the system, if you like, of existing organisations like the CCG, which again is obviously a new body, but so that if it's going to influence strategic commissioning, which is again is one of its key aims, is that its work is programmed in to enable it to do that. So there's no point it deciding on or having a view on trying to influence what health priorities are if it doesn't get around to looking at those priorities until after the CCG has agreed its own priorities. So the work programme has been developed for the Health and Wellbeing Board to map out really the various issues that are going to come up over the future meetings to enable it to influence particular commissioning decisions. There's moving on, there's a integration pioneer presentation that was made at the board, and this is a bid that VOSCA's been involved in terms of looking at, been an invitation really from the Department of Health to look at a particular issue around the integration of services, particularly around hospital discharge, and the proposal put forward by Bristol seeks to address the hospital discharge of people, elderly people and people with long-term conditions, to improve the discharge process and the rehabilitation. The rates, the situation in Bristol is far worse than in some parts of the country, and the aim is to try and improve that. There's no new money with this proposal, but if it is successful, then it will result in the city getting some higher level resources, if you like, in terms of people, ideas to make the changes necessary to improve things. So that's in a moment. A decision is awaited on that particular bid. The board had a short presentation on NHS England from one of the reps there's newly created position on the board, for someone from, if you like, the wider commissioning framework under the NHS. And that's useful again just to get a perspective on what's happening within the region, how the region's constituted, and what impact and role it'll have in influencing health decisions in Bristol. There has been an inquiry into premature deaths of people with learning difficulties, and that was reported to the board, and there were a number of recommendations around that. There is concern that information about premature deaths of people with learning difficulties isn't well coordinated, and there's a knowledge, really, an understanding that a lot of people with learning difficulties do die much younger than the average population, but not clarity about why this is the case. And some of the recommendations are about trying to pull more information together locally so that we have a better understanding about that, and there can be interventions to hopefully in the future to make a difference. So that was a presentation to the board about that particular issue. Unfortunately, I had to leave the meeting a bit earlier, so I didn't catch some of the last bits of it because I had another meeting with my day job, and so that's basically a summary of the key issues that came up before the board at that time, and the next meeting is on September the 5th.